Minister LeBlanc, je vais donner la parole au ministre LeBlanc.
Mr. LeBlanc, you have the floor.
Can you hear me now?
Loud and clear.
Okay, super. So today I am joined by my colleagues, Ministers Alghabra, Blair, and Duclos, and of course by Dr. Tam and Dr. New as well. Our government committed to protecting Canadians during the COVID-19 pandemic. Earlier today, the Prime Minister announced the second installment of the Safe Return to Class Fund. This fund provides up to $1 billion to the provinces and territories. Through this fund, we are helping keep students and their teachers safer. This investment will help premiers from coast to coast to coast support children, their families, and all those who work so hard in our schools. Le gouvernement du Canada
The Government of Canada will continue to work with its provincial and territorial partners to provide a safe education milieu to children, teachers, and school staff during this difficult period.
also announced that Canada's air carriers are stepping up to help protect Canadians as well. The government and Canada's main airlines have agreed to suspend service to Sun destinations right away. Air Canada, WestJet, Sunwing, and Air Transat are canceling air service to all Caribbean destinations and Mexico starting this Sunday and until April 30th. À partir de dimanche,
As of this Sunday, flights to sun destinations from Canada, the Caribbean that is, and Mexico, will be suspended until April 30th.
Sunwing and Air Transat ont accepté
Air Canada, WestJet, Sunwing, and Air Transat have agreed to be part of the solution to help protect Canadians' health and safety. We thank them for that.
I would now like to turn to my colleague, Omar Alghabra, the Minister of Transport. Omar.
Thank you very much, Minister LeBlanc. Good afternoon, everyone. Bonjour. As we've said repeatedly over many months, now is not the time to travel. Our government has implemented a comprehensive, multi-layered approach to protect the health and safety of Canadians. All along, our work has been informed by the latest science and data, as well as by the guidance of public health officials. The best way to protect yourself, your family, and those most at risk of severe illness from COVID-19 in our communities is to choose to stay in Canada. Today, we are announcing additional measures for travelers entering Canada. These measures will affect international travelers, including Canadians, residents, and non-residents, regardless of the reason for their travel. First of all, as the Prime Minister announced earlier, the government and Canada's airlines, including Air Canada, WestJet, Sunwing, Air Transat, as well as Nolinor, have reached an agreement to suspend all flights to and from Mexico and Caribbean countries until April 30th. It will be in effect as of Sunday, January 31st. Secondly, based on advice from Public Health Agency of Canada, we are expanding the existing international flight restrictions on arrival into Canada's 4 largest airports: Montreal, Toronto, Calgary, and Vancouver. Since March of last year, most international scheduled commercial passenger flights have been directed to these 4 airports. However, there were exceptions for flights from the United States, Mexico, Central America, South America, and the Caribbean, which continue to operate and land at other Canadian airports. Effective February 3rd, all international passenger flights, regardless of their point of origin, will now be required to land only at the 4 designated international airports. This requirement will apply to commercial, private, business, and charter flights. The only exception continues for Saint-Pierre et Miquelon. To sum up, anyone who's planning to travel and to fly into Canada is strongly encouraged to take note of this information. To make sure they're compliant with the new requirements, we urge you to cancel any plans to leave Canada in the near future, including for spring break. In conclusion, I want to thank Canadian Airlines for their leadership. COVID-19 has led to an unprecedented situation in the aviation sector. Our government understands that a strong air sector is vital for Canada's economy and the well-being of Canadians. With passenger levels still down almost 90%, been forced to take drastic measures to remain viable. The sector cannot respond to these challenges on its own, and so the federal government is developing an assistance package to Canadian airlines, airports, and the aerospace sector. We will continue to engage stakeholders and partners to fully assess solutions to ensure we have a strong industry that meets the needs of Canadians. We have made it a priority to find solutions that will ensure the airline sector is on sound footing when the economy recovers. Thank you, merci. And now I'll hand it over to Minister Blair.
Thank you very much, Minister Alghabra. And I'm very pleased to join you today and to explain some of the new measures that we will be taking. Fighting the pandemic remains our top priority, and the announcements made today demonstrate that we will continue to take strong action to keep Canadians safe. With respect to border measures, our responses date back to the weeks of January of last year. Weeks before the pandemic was declared, and in response to an evolving situation out of Wuhan, China, we introduced stronger screening measures at 3 of our busiest airports at Montreal, Toronto, and Vancouver. That screening was expanded to all airports receiving international flights in the days that followed. And by early March, this was expanded to include all travelers seeking entry into Canada by air, land, water, or marine. Quarantine officers were deployed at all of our international airports with detailed information being made at all available points of entry. And as the major travel restrictions that we put in place were implemented on March of 21st of this year, have made a difference. And let me remind Canadians what they were. On March of 21st of last year, we banned all non-essential international travel coming into Canada from every country in the world. We took the extraordinary step with our American partners of closing the Canada-US border to all non-essential travel. We ordered all non-essential arrivals in Canada into a 14-day quarantine period. And in response to emerging variants that we became aware of in December, we took further strong action in, first of all, being among the first and only countries in the world to ban all flights initially from the United Kingdom. And then as the variants spread into other areas of the world, we took an additional step of requiring all travelers coming to Canada, regardless of the purpose of travel, to have a pre-boarding test taken within 72 hours of that departure from every country in the world. The measures that we have put in place are, in fact, among the strongest in the world of preventing the spread of COVID-19, and they have been working to help prevent the importation of the virus. Travel numbers are down dramatically due to the restrictions that we have put in place, and consequently, less than 2% of cases in Canada can be attributed to travel in any form, and only a smaller subset of that to international travel. We are still listening, of course, to the concerns of Canadians and working with our provincial and territorial partners. And in response, the new rules for international travel that we are announcing today must drive home the point for all Canadians. Now is not the time to travel. And as my colleague and friend, Minister Alghabra, has noted, funneling international flights to our 4 main airports will result in further reductions in non-essential travel outside of Canada. Introducing updated quarantine and testing measures for those traveling for non-essential reasons is another way we can discourage and disincentivize such travel. Currently, those who travel by air must go through the extra step of getting a pre-departure test before they can return back home. And we are happy to report that since the introduction of this measure 2 weeks ago, there has been an overall 30% reduction in all travel by air. And today we are announcing new measures at the land ports of entry that will also be implemented shortly. Travelers seeking entry at Canada's land ports of entry will be required to provide proof of a negative molecular test result. And this new requirement should come as no surprise, as those who travel by air are also already required to provide the pre-departure test. And at the same time, we will continue to support supply chains on both sides of the border. Exemptions are in place for workers who are critical to our economy, our infrastructure, and our safety. And in addition, we are working very collaboratively with our partners in the United States to strengthen our border measures and to keep our countries safe. As a reminder, having a negative test does not replace the absolute requirement of the quarantine period, which will remain mandatory for 14 days. And no matter where you're coming from or how you may enter Canada, and unless explicitly exempt, you are still required to quarantine for 14 days upon arrival. The enhanced presence of border services and public health officers at the border will help ensure that travelers understand their obligations, and compliance with these obligations is absolutely essential. The penalties for non-compliance can be severe, including up to jail time and substantial fines. I want to also deal with the issue of the responsibility of local police of jurisdiction in the enforcement of the quarantine requirements. The Contraventions Act and regulations designate that contraventions of certain offenses under the Quarantine Act can result in ticketing in certain setting fine amounts. For those contraventions, tickets can be issued in those provinces that have agreements with the federal government to enforce the Federal Contraventions Act. The province of Quebec has such an agreement with Canada. From the outset, since April, the RCMP have been supporting the Sûreté de Québec in the enforcement of the quarantine provisions. And we have recently been advised that the province of Quebec and the Sûreté now is able to they have the capacity to take over full responsibility for the enforcement of these acts. We'll continue to work collaboratively and supportively with all of our policing partners across the country. Contraventions Act remains one of our most effective tools in ensuring that we do not allow the virus to spread in Canada. We urge Canadians who are required to quarantine to comply with the Act, and we'll work closely with the police of every jurisdiction to ensure that those rules are enforced. We'll continue to prioritize the health and safety of Canadians as we make decisions and adapt in real time to the evolving situation. And as I've said, we'll continue to work with our partners domestically and in foreign countries to address all of the measures that are needed moving forward. And at all times, we will rely on science and evidence to inform all of the steps that we are taking. Thank you very much. And I'll now turn the floor over to, I believe, my colleague, Minister Duclos.
Merci beaucoup.
Thank you very much, Minister Blair. Hello, everyone. I am very glad to be here for this important announcement today on transportation and the new measures. They come in addition to the strict measures that we've already put in place since the very beginning of the pandemic. Quickly, 4 important measures. The 4 major airliners servicing Canadians will no longer be flying to the Caribbean and Mexico. Second of all international flights will be funneled to 4 Canadian airports. Third of all, there will be a required molecular test upon arrival in Canada for all travelers. Fourth, or rather, there will be the molecular test before, and now there will also be a molecular test upon arrival. Travelers will also be required to wait in a hotel for 3 days. After that, the 14-day quarantine day period will still be compulsory, even with a negative test. As a Quebecer, I was surprised to learn that unlike Ontario, which has been doing so since the beginning of the pandemic, Quebec has not allowed the Sûreté du Québec to enforce the Quarantine Act on Quebec territory. However, the Sûreté du Québec is responsible for enforcing laws on Quebec territory. The Quebec government has all the authority to enforce this act and has since the beginning of the pandemic. As Quebecers, of course, we want the Quarantine Act to be applied just as effectively at home as in Ontario. The governments will continue to work together, particularly in these crisis situations, and the announcements today reinforce the importance of this fruitful collaboration between the federal government and the provinces. This is particularly relevant in the context of increased surveillance during quarantine periods for travelers. It's been 4 years since a terrorist armed with hatred and an assault rifle burst into a place of worship to attack worshippers in Quebec City. Tonight, we'll be commemorating the victims of this heinous act. Once again, as before, we declare that hatred and violence do not have their place in our society. I'm also pleased to note that we will be continuing to fight against Islamophobia and commemorate the victims. For this reason, we have declared January 29th as National Day of Remembrance of the Quebec City Mosque attack and action against Islamophobia. Dominique, you have the floor. Thank you very much, Jean-Yves, Bill, and Omar. As usual, we'll now ask Dr. Tam and then Dr. New, following her to speak.
Bonjour à toutes et à tous.
Hello, everyone.
Been over 766,103 cases of COVID-19 in Canada, including 19,664 deaths and just over 57,000 active cases across the country. With the recent decline in case counts nationally, there are now an average of almost 4,900 new cases being reported daily over the last 7 days. However, as severe outcomes lag behind disease activity, the number of people experiencing severe illness remains high. And over the past week, there have been an average of almost 4,200 individuals with COVID-19 being treated in Canadian hospitals, including 855 in critical care and 149 deaths each day. Canada continues to monitor for virus variants of concern. To date, provinces have reported over 85 cases of the B.1.1.7 variant and 9 cases of the B.1.351 variant. Yesterday was Bell Let's Talk Day. Many Canadians took the opportunity to reach out and start a conversation about mental health. And this year, as we continue to deal with the challenges of the COVID-19 pandemic, it is more important than ever to take care of our mental health and be there for others in our lives. Staying connected with friends, family, and community is important for our mental health. Social support, even when virtual, can help us cope with stresses, especially during uncertain times. Just because we can't be together physically doesn't mean we have to go through this alone. There are other ways to safely connect to those we love, whether you reach out with regular phone calls, text messaging, or video chats, or join in virtual game nights, video dinner parties, or other virtual entertainment. You can maintain social connections at the same time as lifting your spirits. If at any time you feel overwhelmed by loneliness, one-to-one support can help you cope and feel connected. This type of counseling is available 24/7, free of charge, for young people and adults through Wellness Together Canada. The online Wellness Together Canada portal also has more tips for staying connected, as well as self-guided programs and resources where you can learn about managing loneliness and improving your mental well-being at your own pace. It is said that less than 1% of the population has ever run a marathon. But now that we're all part of the COVID-19 marathon, one of the biggest collective efforts in Canada and worldwide, let's keep working together and giving our best effort. Every vacation travel we postpone for a better time in the future, every outing or activity we avoid, shorten or limit to essentials, and all the diligence we apply to hand washing, masking, and spacing will help to reduce the spread of the virus. Let's dig deep and get through this together. Thank you.
Bonjour à toutes et
Good afternoon, everyone. There have been over 766,103 cases of COVID-19 in Canada, including 19,664 deaths and just over 57,000 active cases across the country. With the recent decline in case counts nationally, there are now an average of almost 4,900 new cases being reported daily over the last 7 days. However, as severe outcomes lag behind disease activity, the number of people experiencing severe illness remains high. Over the last week, there has been an average of almost 4,200 individuals with COVID-19 being treated in Canadian hospitals, including 855 in critical care and 149 deaths every day. Canada continues to monitor for virus variants of concern. To date, provinces have reported over 85 cases of the B.1.1.7 variant and 9 cases of the B.1.351 variant. Yesterday was Bell's Let's Talk Day. Many Canadians took the opportunity to reach out and start a conversation about mental health. This year, as we continue to deal with the challenges of the COVID-19 pandemic, it is more important than ever to take care of our mental health and to be there for others in our lives. Staying connected with friends, family, and community is important for our mental health. Social support, even when virtual, can help us cope with stressors, especially during uncertain times. Just because we can't get together physically doesn't mean we have to go through this alone. There are other ways to safely connect with those we love. With calls, text messaging, or video chats, or join in on virtual game nights, video dinner parties, or other virtual entertainment. You can maintain social connections at the same time as lifting your spirits. If at any time you feel overwhelmed by loneliness, one-to-one support can help you to cope and feel connected. This type of counseling is available 24 hours a day, 7 days a week, free of charge for young people and adults through Wellness Together Canada. The online Wellness Together Canada portal also has more tips for staying connected, as well as self-guided programs and resources where you can learn about managing loneliness and improving your mental well-being at your own pace. It is said that less than 1% of the population has ever run a marathon, but now we are all part of the COVID-19 marathon, one of the biggest collective efforts in Canada and worldwide. Let's keep working and giving our best effort. Every vacation trip we postpone for a better time in the future, every outing or activity we avoid, shorten, or limit to essentials, and all the diligence we apply to hand washing, masking, and spacing will help to reduce spread of the virus. Let's dig deep and get through this together. Thank you.
Merci beaucoup.
Thank you, Dr. New. Corinne, we're ready to take questions.
Now.
Merci. Nous allons donc passer à la period. As a reminder, each reporter gets one question and one follow-up. À titre de Donc, pour vous rappeler, titre de rappel, chaque journaliste a le droit à une question et une question de suivi. Opérateur, à vous la parole.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Mackenzie Gray. Your line is open.
Hi there. First question is either for Dr. Tam or any of the ministers who want to answer it. When you look around the world and see hotel quarantines that have gone in previously, you look at Australia and New Zealand, they put in 14 days, yet Canada decided to go with 3. Can you give any insight into why a 3-day quarantine period was chosen? And also, just on the same, the Prime Minister said it was going to cost $2,000 for 3 days in the hotel. Can you give us any more information on why that is the number? Because that seems quite steep for 3 days.
Yeah, I think, as all of these announcements, there are many today, it's really looking at all the different layers of additional measures we're already putting on top of the existing ones. So the basic foundation of our public health measures is the 14-day quarantine. So what we're looking at is that we're already having mandatory pre-departure tests. We're going to get an arrival swab, and then people are going to go to the hotel to await the essentially the results. Anyone who has or who have difficulties quarantining according to a strict quarantine plan, we're going to tighten up even that plan, will of course be asked to stay at the federal quarantine facility. But if you had a negative test and you got a good quarantine plan, then you're allowed to move ahead and then be asked to take another swab on day 10 before release. So it is a balance. We do know that just based on our experience at our current quarantine sites, that there's a lot of potential for the need to balance out the unintended consequences. People have to adjust to the hotel. Some of them have other needs, mental health issues. So I think it is important to know that it is not without a lot of thinking to try and take all of these travelers into federal quarantine sites. But I think with the testing, and that's a PCR test as well, that we are able to take this policy. And we can always review this over time as well. But they will still have to undergo the 14-day quarantine measure. Why? Well, I think the cost, again, this I think is a ballparking. But this isn't like any other one where there has to be infection prevention control measures, security and other costs as well, not just your regular stay at a hotel. So I think a ballpark was provided, but I'm sure that would be refined as we begin the implementation.
My follow-up question is for the Transport Minister. Minister Alghabra, you said that an assistance package is underway right now. The Prime Minister was very complimentary this morning of the CEOs of the airline companies. I'm wondering why you think these companies deserve a bailout at this point in time. Air Canada has been able to raise a ton of money on the markets. They've held money from many Canadians for fares. They paid influencers to promote these vacations that have been banned today. Why do you think these companies should get public dollars when they seem to be hanging in there okay during the pandemic?
Mackenzie, thanks for your question. Look, we actually announced last November that we started discussions with the airline to assess support for that sector. If you look at the data, the airline sector has been hit the hardest out of all sectors in the economy because of COVID. And it is the vitality and the resilience of the airline sector is extremely important for Canadians, for Canada's economy, for Canada's security. So we've initiated discussions with the airline last November. Now, it's important to express appreciation for their leadership today by agreeing to voluntarily suspend flights to sun destination. I also want to recognize the thousands of aviation employees who have been hit really hard. I know all Canadians have been hit really hard. I know all Canadians have been making sacrifices. But I could tell you, as a Minister of Transport, I have an appreciation for the aviation sector and what it's going through. So I'm not able to tell you yet what shape or what form the arrangement is going to look like, but we recognize that that there are thousands of jobs at stake, that Canada's economy and Canada's security at stake. So we're entering into these conversations with the recognition of how important it is for Canada. But all of those aspects that you brought up will be taken into account as we are having this discussion with them.
Merci. Thank you. Prochaine question. Next question.
The next question. La prochaine question est de Catherine Lévesque de la presse canadienne.
Catherine Lévesque, Canadian Press. Please go ahead. Question. Hello, everyone.
In English. First to maybe Minister Blair or Minister Alghabra. I was wondering, why not ban flights to Florida? Because considering there are many Canadian snowbirds who travel there every year, why just ban travel to the Caribbean and Mexico?
Thank you for the question. And just let me be clear, we're not banning any flights. What we're doing is we're calling on all Canadians to cancel their flights, not just to the Caribbean, not just to Mexico, to all destinations. So, the Prime Minister has been clear for a while. I'm repeating it right now. We're calling on all Canadians to please cancel your vacation. The destinations to the Caribbean and Mexico has. We looked at the destinations where most Canadians spend their vacation. It's mostly so there is a voluntary agreement and understanding with the airlines that it's best to suspend their airlines. Now, for people who are traveling to the U.S., they will be subjected to the same requirements that we subject all arrivals to, pre-departure test, and the new measures that were announced today about testing on arrivals, quarantining at a facility at their own cost. And then maybe I'll let Minister Blair talk about what else is being worked on with our friends in the United States.
Thank you very much, Omar. First of all, let's be very clear. What we're trying very hard to do here is eliminate all discretionary, non-essential travel. We have urged Canadians and told them now is not the time to travel. And unfortunately, some of them are making the choice to engage in non-essential travel. We think that it's therefore, if they're going to make that choice, that they should bear the full cost and responsibility of all the measures that are necessary to keep Canadians safe as a result of the choices that they made. And when we think about what those costs are, by the way, it's not just simply the cost of a hotel room, but we're going to have to put significant measures in place to protect the health and safety of the people that work in those hotels. So there are health measures, security measures, testing measures, and transport measures, all of which we don't believe that Canadian taxpayers should be on the hook for paying any part of the cost for the choice and the decision that some individual has made to engage in non-essential discretionary travel. And so once again, we'll repeat, we want Canadians to make the choice. Now's not the time to travel, stay home. I also, in response to the point that Minister Alghabra made, we are very much in discussions with our partners in the United States. As you're probably aware, the new administration of President Biden has indicated that they are working and going to bring forward, within a 14-day period, new measures to secure their borders, including the border, of course, with Canada. We have found it useful from the outset. So 10 months ago, we entered into reciprocal arrangements with the United States on most of our border measures, and we're working with the United States. There are a number of things, and we've already made reference to a loophole that currently exists in the fact that they allow flights of non-essential flyers into the United States, whereas we've banned them coming into Canada. And so there are ongoing discussions on a number of measures that we believe can improve the safety of and the integrity of our borders as we respond to the risk of COVID-19 spread.
Okay, thank you. And I was also curious, what will happen with the canceled trips in the Caribbean and Mexico? Will customers be reimbursed, or will they have a credit from the airlines?
Thanks again for the question. Look, we're very much aware that many Canadians have had to cancel their flights since the pandemic started, and obviously they'll also be impacted by this recent development. And these cancellations were through no fault of their own. So we're very much aware of this, and we are taking this into account as we are having conversations with the airlines about moving forward.
Merci. Thank you. Next question. Prochaine question.
The next question, la prochaine question est de Mia Rabson from the Canadian Press. Please go ahead. Your line is open.
Hi, yes, ministers. Thank you for talking a little bit about I'm just a little confused because there's Canadians that are traveling all over the world for vacations right now, not just to these so-called sun destinations in Mexico and the Caribbean. They're going to Europe, they're going to the United Kingdom, where we have one of these variants. So you're cutting off people with family ties to specific countries and you asked the airlines to stop these specific destinations. Why are you not asking them to stop flights to other destinations, including ones with the variant? And what message do you think it sends that only parts of the world are being singled out like this?
Mia, thank you for the question. I'll try to answer your question. Look, we are asking all Canadians not to travel to all parts of the world for vacation. I know it's a massive sacrifice. I know some people were hoping to connect with their families who are abroad. Look, we just also called on Canadians during Christmas and previous holidays to even the ones who live at home not to visit their family members. So we are asking all Canadians to cancel their trips abroad, regardless of the destination or if it was visiting family or vacation. The sun destination, there was an agreement that was reached, the voluntary suspension by the airlines. Does not necessarily single them out. It's because there were most vacationers go in Canada, and all other travelers are going to be subjected to continue first, be tested prior to departure. Second, to be tested when they arrive. Third, to be asked to quarantine for up to 3 days until their test results are out. Fourth, to pay for that accommodation. Fourth, to complete their 14-day quarantine. So today, we have one of the strictest measures in the world for travelers. And I know this is an extra burden. We're in this together. We've been asking Canadians to sacrifice for now 10 months. Like Dr. New said, we're in a marathon. We are asking not to waste the past 10 months. We need to continue on our track so we can pull out of this as quickly as possible and get back to normal. Thank you.
Okay, but you're asking everybody not to travel, but you're only asking airlines to cancel flights to specific destinations, not to United States or Europe, for example. But my other question is for Dr. Tam. There was news today from Johnson & Johnson about their vaccine and how effective it is. And it sounds that it's good, but maybe not quite as good as Moderna or Pfizer. And I'm just wondering if there's any plan for determining who should get what vaccine as we sort of approve more. Is there going to be a determination as to which one might be better for others? And how is that determination going to be made?
Thank you. And I think like all vaccines, we have to actually get that data reviewed. And that's done by a number of layers. And one is, of course, Health Canada's regulatory review. So, we can't just sort of take the sort of news release. Secondly, our National Advisory Committee on Immunization will review all approved vaccines. So this, if it gets approved or if it's about to sort of be in the pipeline for approvals, that work will begin. The same with the AstraZeneca vaccine, same thing. We will have to look at the data in relation to that particular vaccine. So in the clinical trials, what age groups were looked at, and other specific information that will help us, provide that those recommendations. So, and then of course, after the National Advisory Committee on Immunization has provided recommendations, we facilitate, discussions amongst the Special Advisory Committee on COVID-19 and other federal, provincial, territorial tables, such as the Canadian Immunization Committee, to come together to look at what the recommended use might be. So, because right now we're in a very, I think, challenging period, when many vaccines, we would love to have more of them, but we don't have them right now. So how do we best use these other vaccines, should they become available, is really important, but it is quite a complex picture. So that's why, at the outset, we said that this is one of the most complex vaccine programs we'll ever implement in Canada. But there are other features of these vaccines. For example, Janssen is a 1-dose vaccine. AstraZeneca is 2 doses, but they can be stored and they can be logistically much easier to handle than the mRNA vaccines. And so those are the kind of characteristics and criteria that will be reviewed for how do we best use the supplies that we may get of new vaccines.
Merci, thank you. Prochaine question, next question.
The next question, la prochaine question est de Marie Vastel du Devoir. Please go ahead.
Marie Vastel, Le Devoir. Question.
Question is for Dr. Tam, so I'll ask it in English. I was hoping to get a little bit more of a concrete explanation of what the increased surveillance will be. In the Prime Minister's announcement, it says that people who test negative on arrival will be able to go back home to finish their quarantine under increased surveillance. Can you give us examples of what exactly will change with these new measures? You mentioned in an earlier response to a question that the quarantine plan would be tightened up. Is that it? Like, is that the only thing that is changing, or what else is changing?
Yes, so there's many different layers of strengthening. So first of all, and even starting today, there'll be increased security contractors that would go and do more, I would say, door knocking on to check on people who are in quarantine. So that I think starts almost either today or tomorrow in Toronto, Montreal, broadening out to 35 cities, so that we can have an added layer of assurance that people are observing that quarantine in just in terms of compliance, but also that there's an opportunity to engage and make sure they are safely quarantining. Certainly there'll be more phone calls. The quarantine plans themselves, given the variants, we will be looking very carefully at who that individual traveler may be in a household with, for example, and certain prohibitions of what a satisfactory quarantine plan might entail. Could include, for example, if you were living with someone who is a healthcare worker. We will have to really look at that to see if that's appropriate. Not just whether you're living with someone who is at high risk of serious illness, which is what part of the quarantine plan requirements are right now. At the same time, it's not just the pre-departure test, the arrival test, but also a test at day 10, so that we can have another checkup to see if someone has developed, has been infected, but has a longer incubation period. We will pick them up at that stage as well before they come out of the 14-day quarantine. If they're positive, if their symptoms, they will have to restart another cycle of isolation. So, so these are just some of the specific measures. Yeah, so I think I might stop there. There's probably things that other aspects that will be strengthened as well.
Thank you. I appreciate it. Just a clarification, and it's not my follow-up. I'll ask my follow-up as well. But just a clarification, the test on day 10, is that for people who have gone home to finish their quarantine as well, or only people in the public health centers? And my second question, my follow-up, is for Minister Alghabra. You mentioned to my colleague that you're taking into account the fact that these airlines have had to deal with a lot of cancellations and perhaps reimbursing travelers or giving them a credit. Did you promise airlines a package in exchange for their agreement to suspend all these flights?
Thanks, Marie, for the question. We actually agreed to enter into discussions with the airline last November. So the conversations about assessing the challenges that the airlines are facing, refunds, regional routes, travel agents, also compensation, those were all part of the initial motivation for conversations. So this is ongoing. I agree today's announcements are adding extra stress and pressure on the airlines. But no, today's agreement was voluntary and it was not conditional on that. But we know that it is part and parcel of the discussions that has been taking place and will continue to take place. And we hope to come up with an answer in short order.
And I'll just answer that last part of the question is that, yeah, whether you are quarantining at a designated quarantine site from the federal government or at home, you will be required to have the day 10 test.
Thank you. Merci. I would like to let everyone know we have about 10 minutes of questioning left. Il nous reste environ une dizaine de minutes de questions. We will now take the next question. Opérateur.
Next question. La prochaine question est de Jacques Galland du Toronto Star. Please go ahead. La parole est à vous.
Yes, hi. My first question is about why is it going to take a few more weeks, as the Prime Minister said this morning, to implement this mandatory testing regime at the airports? Premier Ford in Ontario has said that he's looking to implement this at Pearson Airport in the next few days.
So this is Teresa Tam. I'll answer that question first. Of course, there's ramping up of implementation, so that is important. But what you've also mentioned is also important in that we do have pilots, taking place in different areas of the country, and they have been absolutely valuable in helping us look at the implementation of testing at the point of arrival and later on. So Alberta has a pilot, Toronto, and with Montreal as well. So these pilots, in the meantime, will continue or to be implemented, so that it totally helps how we're going to escalate the testing measures at the airport, and just want to thank the provinces who've been collaborating with us on those.
And perhaps perhaps I can add something as well. I've been having an ongoing discussion with Premier Ford and the Ontario government about the importance of strengthening our posture at the border. So the decisions that were taken and announced by the Prime Minister today to have this mandatory testing on arrival at 4 airports, obviously including the Toronto Pearson Airport, I think respond to the concerns of the Ontario government. And they have offered from the beginning of this conversation to be partners with us. And I think it's important to reinforce that partnership and say that we'll work with the Ontario government and all these measures going forward. I don't know if my colleagues, Bill Blair or Omar, want to add something.
No, I don't have anything to add.
Okay, did you have a follow-up?
Yes, I also just wanted to ask about Vaccinated international arriving passengers. I've already heard from one Canadian woman in Florida who says she and her husband have both been fully vaccinated, and she's wondering if these new travel measures will also apply to people who have been vaccinated.
It's Teresa Tam here at this.
Go ahead, Teresa.
Yes, at this point in time, yes. Obviously, this is an area of ongoing discussion, and there's one of international to look at the impact of immunization. There's still some unanswered questions about the effectiveness of the vaccines in reducing transmission and the duration of protection. But we expect those kind of questions to get answered in the coming months. But it is an area of active discussion from an international perspective, for sure.
Merci, thank you. We will take a question. Opérateur, c'est à vous. Operator.
Thank you. The next question, la prochaine question est de Émilie Bergeron de l'agence QMI. Please go ahead.
Émilie Bergeron, QMI. Question. Hello. With these additional measures for quarantine, do you have an idea how much all this will cost the federal government? Answer. Jean-Yves, would you like to respond to that question? We still do not have an estimate for these measures. They're severe measures and solid measures that are being developed and implemented, and we'll have more information in the coming days. Thank you. Question. Follow-up question. With regard to essential workers who will be affected by these new measures, what will things look like for them? Will they have to undergo a compulsory test and be required to quarantine as well? Answer. This is Dr. New. Perhaps I can answer. What we're talking about right now is really for non-essential voyageurs. That is definitely clear. When it comes to essential workers, however, who are required to perhaps cross the border with the U.S., truckers bringing in food or other essential goods, well, we're currently examining other options. Perhaps there could be some sort of testing, regular testing, or other public health measures, individual health measures. That's what we're analyzing right now, and we're also discussing these options with our provincial and territorial counterparts. Did you want to add anything, Dr. Tam? Not really. The requirements for a pre-boarding test are still valid for essential workers as well. As for agricultural workers, the quarantine period is still a requirement. Of course, we'll be careful to truly support these essential workers.
Safe places to quarantine as well. So again, working with the provinces and territories, on va travailler étroitement avec.
We'll be closely working with all the sectors, the provinces and the territories for these measures for essential workers.
Merci à tous.
Thank you.
This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui. Bonne journée.